Welcome, everyone, to the 10th Annual Social Justice Speaker Series. It is just one past the top of the hour, 5 p.m. We're going to wait for additional attendees to log on, but while we're waiting, please take the time to look at the slide if you're interested in continuing education opportunities and register for those opportunities now. We'll begin in about 4 minutes. Welcome, everyone. Again, we'd like to welcome you to the 10th Annual Social Justice Speaker Series. We're waiting for a few more attendees to log in, and we will begin at exactly 5 after the hour. Thank you again. If you're interested in participating in any of our continuing education opportunities, please take the time to register now. I'll also put the information in the chat.
Thank you to our DJ, Dr. Wilson. Lovely music. I appreciate you. Oh, my goodness. Oh, let me get back to my Zoom. Good evening. I am appreciating all of you who have been here before and putting sort of where you're located into the chat. It's so great to see folks primarily from the Bay Area putting in their hometowns. If you haven't had a chance to do so, it's always nice to see who we have on board. And we have folks as far as Queens. I did see that in the chat, I believe, at our last meeting. So welcome. And good evening, and welcome to our second webinar of the 10th season of the Touro University, California Social Justice and Public Health Speaker Series hosted by the Public Health Program. My name is Gail Cummings, and I am the director of the Public Health Program, joined by Dr. Deirdre Wilson, who serves as the chair for the Community Action for Health concentration in the Master of Public Health Program here at Touro University, California. Together, we coordinate and host the Social Justice Series as part of the Public Health Program. It's a course, but it's also a seminar that is open to the community at large. You know, as public health minded students, professionals, and many engaged citizens, many of us who work with a deep social justice framework, it has become even more urgent, this framework, and evident over these last couple of days. These outcomes have been really highlighted, have been highlighting sort of the critical importance of the work that we do and the challenges that we are still facing. One of the issues, as you probably all are very well aware, that has come to the forefront is misinformation, disinformation, both of which remains really significant public health concerns that, you know, we're going to have to roll up our sleeves and really address collectively. And at the same time, we're really fortunate to be gaining a deeper understanding of how sort of local policies affects health and well-being, and how we can, you know, really kind of start at the local and regional levels where the most impact can be felt. This is, you know, kind of where the saying goes, where the rubber kind of meets the road. You know, I'm saying all this to say that we are really appreciative of your participation in this webinar series, particularly this year's topic that is focusing on the commercial and economic drivers of health. We really do have the tools, and we're learning to strengthen these tools necessary to create change. But what's crucial now is sort of maintaining that momentum, advocating for health and well-being of our population's most vulnerable and marginalized communities, protecting women's health, protecting our environment, supporting science, reinforcing the need and resources to address climate change. As here in the Bay Area, particularly in the northern counties, we're starting to experience, what we call our fire season. So a lot to contend with, but we are trying to take look at this one piece at a time, and again appreciate your interest in this work. And we want to thank you in advance for being here and your continued dedication to advancing social justice and health equity. If this is your first time joining us, the purpose of this seminar series is to provide upstream discussions around social justice and public health for students in our MPH programs and professionals in public health, medicine, education, pharmacy, and nursing degree programs, as well as for many of our global and community partners. And each year we focus on a different topic. And as you know, this year's topic is those corporate and commercial economic drivers of health and justice. So over the course of the next 5 sessions in the series, we'll hear from leading experts across diverse fields of health policy, public health, history, and social justice who will help us understand the current commercial and corporate landscape, with discussions centered around how it's developed, how it's been deployed, and the ways it's really undermined social justice and health equity. And of course, looking at strategies as a way forward. We are really excited to learn about the food industry as a nationwide and global commercial determinant and driver of health. And we have a magnificent guest that will be joining us to have this conversation today. And before we get started, I want to turn it over to Dr. Deirdre Wilson with some housekeeping.
Thank you. I'd like to remind our students that this is a course and that there are some requirements that this course has. Please make sure that you complete your evaluations. If you have any questions about the content or of the course itself, please send an email. I'd also like to remind you all of our roadmap for this evening. We are scheduled to discuss food industry as a commercial determinant of health. After the discussion, we will have an opportunity for Q&A. So if you have any questions that bubble up during the course of our discussion today, please jot them down and put them in the Q&A chat that's available or that will be available to list your questions. If you're interested in continuing education opportunities, that information is in the chat. It was also on the initial screen, but you have an opportunity to receive continuing medical education, also CPH. If you have a CPH for the master's degree in public health, there's continuing education on that website. We also have an opportunity for our badges and our micro-credentials through the public health program. So if you are interested in any of these, those links are in the chat. I'd now like to introduce our speaker for today. Our speaker is Dr. Eduardo Gómez. Dr. Gómez is a political scientist focused on global health policy, particularly in emerging economies. His most recent book, Junk Food Politics, examines the impact of fast food and beverage industries on public health. He has led major research projects, including the Lancet's first series on political science and global health, and published widely in journals and in the media. Dr. Gómez has served on health policy commissions for the Rockefeller Foundation and Satcher Health Leadership Institute, with research funding from organizations like the Robert Wood Johnson Foundation, and also the Rockefeller Foundation. Previously, he held academic positions at King's College London and Rutgers University, and has worked with the RAND Corporation, the World Bank, and Inter-American Dialogue. Dr. Gómez holds a PhD from Brown University, an AM from the University of Chicago, and a BA from the University of Virginia. He is also a U.S. Air Force veteran and member of the Council on Foreign Relations. Dr. Gómez is currently professor and director of the Institute of Health Policy and Politics at Lehigh University. So please welcome Dr. Eduardo Gómez.
Wonderful. Thank you so much, Dr. Wilson and Dr. Cummings, and for this wonderful opportunity to join everyone this evening. And thank you all for taking time from your very busy schedules. I know for some of you, you're in school, and this is a very, very busy time. And so I'm really grateful for all of you to join us this evening for this discussion. As Dr. Wilson mentioned, I'm a political scientist by training. And I started my career studying Brazil and comparing Brazil to the United States in response to the HIV/AIDS and obesity, what I call the contested epidemics. And I've always been curious about how political elites contest public health challenges, diseases and healthcare issues that there's no clear consensus within government about what government's role is, what civil society's role is. And over the years, I started to study more in Brazil and other BRICS countries, Russia, India, China, South Africa, looking at obesity issues and type 2 diabetes. But then I got very interested in why was it that a lot of these countries were implementing very aggressive awareness campaigns about childhood obesity, about type 2 diabetes in Mexico and Brazil and India and China, these fast-paced emerging economies. But there was still, despite these policy awareness campaigns and even soda taxes, you were still seeing high levels of childhood obesity and type 2 diabetes. And so that was a puzzle for me. And then about 5 or 6 years ago, I started to investigate, or a little longer than that, I started to investigate the role of industry and how industry shapes research and ideas that shape government views and policies on these critical issues of ultra-processed foods and sodas. And so that's where I started to get involved in trying to understand the politics of the commercial determinants. Because as many of us, I'm sure, would agree, major food and soda industries have a tremendous impact on our health. And they have a lot of power on how our political elites think about these issues and how they create policies in response. And in my research, I have found that these industries have a lot of power in emerging middle-income countries for various reasons. A lot of it having to do with presidents wanting to grow their economy, provide a lot of jobs and opportunity, seeing these corporations as partners in providing these opportunities. And so I'll talk more about that a little later, but that's what my background has been. I'm a political scientist, so I really address these issues from a politics, institutions, and interest groups approach. But I love comparing the US to other countries. And the current project I'll talk about later that I'm doing with the Robert Wood Johnson Foundation looks at food security as a right and what the US can learn from other countries that are doing better than us on this topic. But for now, I'd like to talk about how did this commercial determinants of health become a problem? This is a very new area of research. It's only emerged within the past 10 to 15 years. And a lot of it had to do in response to researchers focusing on the tobacco industry and air pollution and looking at how these sectors were impacting our health. And over time, because of globalization, increased investment in market reform, and emergence of all these products that we've seen in the US and other countries, these industries and their products have had more and more influence on our health in many different ways. And that's why this commercial determinants of health issues become so important now, because we see the multiple impacts of big commerce in our lives, from the quality of the air that we breathe and air pollution to the quality of the food that we eat, and the scarcity and difficulty and and how difficult it is to get good nutritious foods, especially in a lot of our poorer urban areas and rural areas in the US. And so that's why commercial determinants has become a very important topic. And we've made a lot of progress in academia. The World Health Organization, the UN, has done a lot of wonderful work on this issue now. And now I'm working with other colleagues in the WHO on their first global report on the commercial determinants of health. And so we're making progress in trying to understand this. But how did this issue come about? How did the commercial determinants come about? Well, there were several different factors. One of them was globalization, right? And especially globally, looking at how all countries around the world, beginning in the 80s and 1990s, started to open up their economy. For decades before, a lot of countries, such as India and China, did not have access to a lot of ultra-processed foods, especially foreign-based ultra-processed foods. So you saw with Deng Xiaoping in China in the 1990s and free market reform, and India starting to reform its economies in the early 1990s, this huge increase in foreign food products. A lot of products that did not have access to, but we're reading about in the newspapers and seeing television. So we saw an increased demand globally for a lot of these ultra-processed foods and sodas. We were here in the US, had more experience with this, but this was a dramatic increase in the 90s and early 2000s. So a lot of emerging middle-income countries, in Mexico especially, our neighbor. But also, as I talk about in my book, Junk Food Politics, there was an issue of opportunity and fear that industries encountered. A fear of in the US and other Western nations knowing more about good nutrition and not purchasing products because of that, and opportunity, seeing these new emerging markets as new markets where they could invest in and have more demand for their products and growth. And so that element also fueled this commercial determinant of health in the food sector. And another thing that really complemented this, and I talk about this in my book, Complementary Institutions, was the role of presidents wanting to have these companies in their countries to provide more job opportunities, to tackle poverty. In many countries, like in South Africa and in India, a lot of these, especially in South Africa, that I talk a lot about in my book, but also in Mexico and Brazil, these companies, a lot of ultra-processed food companies, producing companies, and provided job opportunities for a population that was still very poor. And so a lot of presidents saw these companies as major partners in trying to develop their economies and to provide a lot of job opportunities. And that's why we see, and as I talk about in my book, a lot of presidential and government support for these industries. But we also see in these countries the food sector, soda and fast foods, thriving. Some of you may not know, but one of the countries that's seen the highest growth rate of Kentucky Fried Chicken fast food chains has been in China, where KFC has exploded in popularity, and McDonald's. And in contrast to what we find here in the US, KFC and McDonald's are very popular establishments in Asia, where families often go to celebrate weddings or anniversaries. It's a high social status. So in these countries, because they're of the newness of these food industries, and because for cultural reasons, very popular having Western products, we see a very fast-paced franchise growth in a lot of countries. We also see sodas becoming very popular in our neighboring country in Mexico, especially after the North America Free Trade Agreement in 1996, which eliminated tariffs and facilitated the import of sodas and other products into Mexico, but also in Canada. Coca-Cola has become became very popular in Mexico, and eventually became part of Mexico's food culture in many ways. I lived in Mexico and worked there for a couple of months, and have gone there many times for my research on obesity, type 2 diabetes. And you can certainly see Coca-Cola being a unique part of their culture. And even in some parts of Mexico, in the southern state of Chiapas, Coca-Cola is used in religious indigenous ceremonies. It's something that is very sacred to some communities, but also very popular. But the government has really changed its stance on Coca-Cola after COVID-19. I'll talk about that a little later. But before these recent events, this allowed Coca-Cola to have a lot of political and social power, and in many ways obstructed Mexico's efforts to introduce soda taxes and other policies a little later on. So now we have, in this new globalized context, and these companies emerging in these countries, the emergence of industry as a political power. And I think we've seen this not only in the US, of course, we know that major food and beverage corporations are powerful, but I would argue even more so in emerging middle income countries. Because of their support in government and the employment aspect, we see these countries, these industries, including many different tactics to try to influence policy and politics in their favor. A lot of research in the commercial determinants have looked at several different kinds of tactics. You've had lobbying, which we're very familiar with. We've had closed door sessions or private meetings. Usage of the media to try and downplay the importance of the soda tax, corporate social responsibility, doing things for their community to build social support, political support. There's been a large, long list of tactics that we're still learning about that were very successful in a lot of countries, in emerging middle-income countries. And for several years, they blocked efforts to introduce soda tax. For example, in Mexico, the first country to introduce a tax at the national level in 2014. For many years, the industry was very influential in trying to block the introduction of this tax. Also in South Africa and other countries as well. Eventually, Mexico did succeed in doing that, and I'll talk a little bit more about why that happened. But eventually, also, you had industry blocking regulations on food and beverage advertising. And however, some eventually prevailed. Chile emerges. Chile as an emerging star in how the government started to introduce not only fiscal but important regulations on advertising and sales. And so while there was a delay due to this strong industry opposition, some have emerged recently as stars and what we can learn in the US from. And I'll talk more about that a little later. But why does industry have so much power? We need to unpack this a little more. And for some of you, you may have read my chapter that I wrote in the Sandra Galia's book on the commercial determinants of health, where I wrote a chapter on political science and the commercial determinants. And in that chapter, I try to unpack where this industry power comes from. And as a political scientist, I wanted to explore what is the role of political science theory in trying to advance our understanding of this power and why industries continue to have this power over policy. So what I did in this chapter is I looked at what interest group political scientists or political scientists working on interest group theory, on institutional theory, and what they've said in the literature in political science and applying that to food and beverage. And what I found that what helps to explain this ongoing power of industry is we need to look at their power in two dimensions, both within government and below, from the bottom up. And within government, we see, with regards to tactics, industries behaving in a very clandestine approach, especially when the issue is very technical in nature. When it's dealing with nutrition labels, food advertising, issues that don't receive a lot of media attention. We see what Pepper Culpepper at Oxford University calls quiet politics, where industries meet very quietly with government officials, and where government officials rely on industry for technical expertise on how to improve the quality of their products, how to create more improved food labels. And here we see a lot of influence when compared to food industries in the area of soda taxes, right? Taxes is a very big political issue. It's out there in the media, and industries may not have that much influence when politicians are being questioned all the time about these new taxes that are being introduced on food and beverage. And so a lot of political science insights into these quiet political strategies helps to explain why is it that globally we see food taxes and soda taxes as the most popular policy response, but we don't see regulations of advertising and sales to be as popular. And I would argue, and others argue, that it really has to do with this quiet politics, right? Another thing that we learn from political science is the importance of institutions. Interest groups and big corporations don't always get what they want. The design of institutions often determines to what extent they will have influence. In the US, many have argued that the way our congressional subcommittees are designed determines to what extent industries have to spend a lot of money on convincing committee members about the importance of introducing regulations. And several scholars have talked about this. And so other times, subcommittee members may be in opposition to what industry wants, and their industry has to spend more money in lobbying and trying to convince subcommittee members. So that's important to understand, but also presidential institutions matter a lot. And whenever presidents change their mind about their position on soda, it can have, or other foods, it can be very powerful. And here I'd like to talk as a good example, Mexico. For many years, some of you may know, Mexico, as I mentioned earlier, was really dominated by a lot of these soda and food companies, and especially Coca-Cola was very powerful. But in recent years, after COVID-19, the former president AMLO, he changed his stance dramatically on Coca-Cola. And it really had to do a lot with COVID-19, where activists and government officials were realizing that perhaps drinking food and eating ultra-processed food is not the wisest thing to do in order to weaken your immune system. And at that time, activists for many years had already been pressuring the government. And AMLO, 2 or 3 years ago, publicly started to denounce Coca-Cola and other soda products and saying that it's not a good thing to be consuming. In a context where presidents are very powerful in Mexico and where the media is always covering them, this can have a tremendous amount of impact. And so Mexico really showed us that this can open up the door for more activism and more awareness and introduction of new policies. In Chile, Chile, some of you may not know, beginning about 10 years ago, the government introduced perhaps the most aggressive policies in response to food and beverage. Not only introducing taxes, but also advertising and sales regulations, improvements in food labels. And it did this because of a senator, Senator Giraldi, who himself was an MD and who was in charge of the Senate's Committee on Health. And he was a very charismatic, powerful individual who was able to raise awareness in government and civil society, and was a really charismatic individual who had no fear of going in public and talking about these issues, much like Senator Sanders here in the US, who often goes in public talking about the importance of junk food and addressing that in our children's health. Senator Giraldi did the same thing in Chile and had a lot of power and influence within the Senate. That, coupled with activism and greater awareness and activists and academic researchers providing information to the Congress, led to these massive reforms about 10 years ago, which not only fiscal policy, but things that we could never think about in the US, such as improving cereal boxes. By law in Chile, you will no longer see Tony the Tiger on Frosted Flakes. You will not see any cartoons on cereal boxes, which could entice children to purchase these goods. This is really major if you think about it. And every time we go to the grocery store, we see how colorful these cereal boxes are, right? And so this was a major achievement. Mexico adopted the same policy later on. Chile was the first also to introduce changes to their food labels, which Mexico adopted later and Colombia has adopted recently. They introduced these black octagon signs, 3 big black octagon signs that are on front of packages that are high in salt and sugar. and say have warning signs, and these are very visible. And arguably, this is much more effective than very small print at the bottom or behind the package, right? Because you see this right away, people really question it. And so this has had a really positive impact. And so you do see these innovations because of presidents and leadership within the Senate. And it really shows us in the US how important it is for our political leaders to have no fear in addressing this issue. And I think that I talk about this in my book, and I think that we can, you know, introduce this as an issue that is challenging our children and our poor communities. I think, and in our food deserts, I think that we can get more political interest and support for these issues.
Dr.
But
Gómez.
another thing yes, yes.
I'm so sorry to interrupt.
Sure.
Yeah, this will give you a chance to take a sip of coffee. You have given, us so much to chew on with regard, just really kind of laying the foundations of how we got here with the marketing practices, but also you've introduced the concepts. Something I'm not familiar with, this idea of quiet politics, which makes so much sense. And you talk a little bit about that in your book as well, and looking at presidential institutions and all of these sort of outside pressures that really kind of guide sort of marketing, just as one example, by the fast food industry. And it's just really interesting when you talk about some of these global examples where it's becoming built into the cultural norms, right? So you have, so this landscape, these pressures from corporate and institutional pressures that are really built into becoming a part of our, our cultural norms.
Yes.
These are huge drivers, huge factors. And I'm just wondering, how do we as public health professionals counteract these huge areas that traditionally are hard to kind of break up, and especially when you look at the impact of the economy. And I know you have lots of examples, global examples, which is really great. And perhaps you can share some examples of what is happening in those countries that are allowing to kind of break through some of those barriers. And if there are any examples you can provide here in the States as well, that would be great.
Yes, this is a fantastic question. We have power as civil society. I just wrote an article that's coming out soon about this, in looking at Brazil, Chile, and Mexico. And what I mean by that is what public health professionals and academics, the public professionals do is really share the research, share the information, use the power that we have in our hands, cell phones, for example, in providing social media campaigns. One of my colleagues in Mexico, Professor Simon Vergara, who is at the National Institute of Public Health, but also the president of the World Obesity Association, I think does a wonderful job of going on Twitter and sharing information to the public about the harms of all these foods and the role of industry. And I've always looked up to him as a great example of what we can do as public health professionals in sharing knowledge and information. And I think knowledge is power in this situation. Of course, we will never have the dollars that these major industries have in funding advertisements and all these things, but we do have a lot of power through sharing information, social media, organizing conferences. And I think that's and research and scholarship and publications, not only scholarly publications, but blogs and news articles. I think that is one thing that we've really learned. Another thing you can do as a public health, someone that works in public health, is partnering with activists and researchers and working with and NGOs. Some of the best NGOs that I know of in Mexico or in Brazil have lawyers, have community activists, academics that work together. In Brazil, there's a wonderful group of NGOs that have these lawyers that defend children's rights, that work together with academics. In Mexico, we also have El Poder del Consumidor, The Power of the Consumer, led by Alejandro Clavillo, that is very academically knows the topic and works with academics and works with scientists. So joining forces like that, I think, can be very powerful, and writing reports and working with them on writing reports and sharing information. So I think those are some things. But also, one of the things that I've seen in other countries, and I think this happens in the US as well, and something that we need to continue, is public testimony. Going to the Congress and testifying. We've had academics that do that here in the US, but I've seen a lot of that in Mexico and other countries where these individuals go and testify in front of the Congress, and the Congress providing an opportunity. And that's really important as well. So I think that all these things can be done to have an influence and to break through the power and influence of these corporations.
If I could interject, thank you so much for explaining kind of one or several things that we can do as public health practitioners, and for our students and community members what they can do. And I think I'm definitely testifying among not necessarily Congress, but here in our state, petitioning and advocating for changes is something that is within reach for our students and community members to participate in this change. I'd like for you to talk a little bit about how food security or insecurity intersects with the promotion of unhealthy foods in middle income countries. But also here, we're finding that people are very stretched, and often cheap fast food may be less expensive than the organic options of whole food in particular communities, especially communities that are considered food deserts. So if you could talk a little bit about that intersection, it would be great.
Absolutely. Well, I think this is a very important topic, and that we see in the US and other countries. I'm sure many of you are aware of a lot of companies, tobacco, ultra-processed foods, targeting food deserts, right? Seeing a lot of advertisements about these food products, investing a lot in food deserts, and taking advantage, like you mentioned, of the low income of a lot of residents, offering very cheap products. This is a dynamic that's happening in other countries as well. And I think that here, this is where the importance of advertising regulations and restrictions is very important. It is very difficult to achieve. But definitely there's a very strong relationship between this, what we call predatory marketing, and the emergence of these foods, and the lack of access to healthier foods. We've seen over the years in the US, especially, the flight of a lot of good grocery stores, wholesome grocery stores, going to suburban areas, where we've seen a lot of companies afraid or not willing to invest in our urban communities. And so this is an ongoing challenge and issue. And there's very little or anything done on regulating the areas where a lot of these foods are being produced, and efforts to introduce healthier options. We are seeing in some communities urban farming, right? And we are seeing some of these efforts to increase access to foods. In other countries, I think it's a little worse. And I think it's another issue that I think we're dealing with in the US as well, is what beneficiaries can purchase with their foods, right? So in SNAP, for example, beneficiaries, if you go to a dollar store, you may see SNAP advertisements of SNAP benefits, welcoming SNAP benefits. In fact, walking distance to my house, there is a dollar store that as you walk in, you have a SNAP advertisement saying that SNAP is taken. In Brazil, same thing. Bolsa Familia, the conditional cash transfer program. A lot of what's purchased with that are cheaper foods. And there are no restrictions on, the quality of foods that you can buy. And so, these are issues that, that need to be addressed, and that, it's a challenge globally. And it is very sad to see. There needs to be greater efforts to have more nutritious foods and more options working with with major grocery stores to make it more affordable. And I think it's a global phenomenon, but I'm glad that you raised that issue because it's something that we really need to learn more about, do more research on, and be more advocates for, and for improving the situation.
Could you tell us a little bit more about your book, your most recent book, Junk Food Politics?
Absolutely. Well, I'm always happy to talk about that. In fact, I have a copy of it right here. If you haven't seen it. This book really emerged about 10 years ago. As I mentioned before, I was talking about, I had been doing work on obesity in Mexico and doing research with my colleagues there on type 2 diabetes. And I was really puzzled by why in Mexico and other countries we're seeing an ongoing rise in childhood obesity, despite efforts to increase the public and awareness about this. And so I really wanted to investigate the role of the soda industry and fast food industry. And I really began to see how powerful they are in these other countries. And so what I did as a political scientist, I said, well, let me try and figure out a good explanation to this. A lot of the literature in public health really focused on certain aspects, lobbying, or there are various different aspects of commercial determinants. And I wanted to use my knowledge of political science theories to really provide an alternative. And so what I did is I looked at the countries of Brazil, Mexico, India, China, South Africa, and I created an analytical framework called the Industry, Politics, and Complementary Institutions Framework that explains, I believe, why industries continue to have power in stopping governments from introducing regulations that I mentioned earlier on advertising, on sales, and improved food labels. And what I found was the answer was very complex. It had to do with history and it had to do with politics. On one hand, the history of what I mentioned earlier, fear and opportunity of industries fearing their lack of influence in our country with respect to nutritional knowledge, fearing a declining market, and seeing opportunity in other countries. At the same time, you had these industries emerging in other countries and having a lot of political influence, both within government, but especially civil society, and partnering with local communities and in providing employment opportunities for communities in these countries and getting communities on their side. At the same time, I found what I call complementary institutions. That is, presidents that are seeing these industries as allies in achieving alternative political goals, primarily reductions in poverty and also improving access to food. And so Nestle, for example, was a very important partner in these and with presidents in these countries. Coca-Cola, a lot, Mondelez International, a lot of different corporations were seen as partners in providing opportunities for employment and providing food. We have to remember that in a lot of countries, and even in our own country, we have a lack of food scarcity, food security is still a major issue. In a lot of countries, we have the double burden of nutrition, obesity, and undernutrition and stunting. So these factors all came together to really give industry a lot of power in these countries. And that's what the book is about. And I talk a lot about, what I really like about the book is I go into details about how industries are working with communities and getting them on their sides and dividing society. I introduced that concept of how when industries partner with academics and researchers, that limits the ability of activists to create a broader network of support in society that can confront industry. And I really feel that at times this is intentionally dividing society so that civil society cannot have a bigger voice by not being able to work with academics and prestigious academics and things. So I really enjoyed that part of the book, but I just really enjoyed just why politics is important. I really don't think that it's a perspective that is taken very seriously. And myself and other colleagues are starting to address this issue. And so that's what this book is about. And it was really, but let me just say that a lot has changed in the past 2 to 3 years. We have seen Mexico in the book. I really don't talk about what happened in the past couple of years, where we saw a president that emerged and really changed the way things are done, and with respect to soda and ultra processed foods. I mean, what's important about politics, what I mentioned in this book, is that things can change very quickly. You know, you can have the arrival of a president that is very powerful and can change things right away. In Brazil, for example, as I talk about, we had up until 2019, President Lula, who was very committed to addressing food security, was very popular, introduced Bolsa Familia. Then you had Bolsonaro administration, very conservative. The first thing that Bolsonaro did, one of the very first things, was to eliminate the National Food Security Council called CONSEA, which was within the office of the presidency. And that sent a big signal to everyone saying the whole era of food security is over, right? They're reducing government spending. And then Lula comes back to power in 2022. And the very first thing he does, I think literally the next day, is reinstate CONSEA. And what he's done is now made food security, again, a major issue. Poverty and food security, a major issue. And Lula's now leading at the G20 and leading the global fight on food security and access to food. So what I say in this book is that presidents make a huge difference. And this is why we need to take politics more seriously, because things can radically change. And I think that's one of the things that I loved about writing this book. And right now I'm working on a book on democracy and commercial determinants and why democracies have failed us when it comes to protecting our children and the poor from these commercial forces. And so I'm still working on this topic, but I'm also looking at other sectors. I'm looking at social media. I'm looking at, of course, food and beverage still, but also social media and other areas that I think need to be addressed.
Right. There are a lot of intersections between those industries that you talk about. I think that it's very difficult as public health practitioners what we have learned is that siloing these issues is not the solution, that there's a lot of intersections. There needs to be a lot of overlap in the way that we approach many of these problems. But I actually want to go back to something you said. So there is a huge ethical dilemma or implications when these corporations or companies are actually doing some good, meeting some political agenda, some community agenda. So even if we come down to more of a community level, providing maybe support of a local Boys and Girls Club or some other community service, where they're providing a grant or other funding to support these organizations. How do we, as community members and as public health practitioners, number one, assess kind of the ethical implications of their involvement in these communities or community activities, and how do we then also kind of separate? What is a strategy to separate out that funding? Do you say, no, I'm not going to receive any funding from Coca-Cola for the Boys and Girls Club, or whatever organization? Or do you somehow find another alternative to work within these corporations?
Yes, this is an ongoing issue. I've received this question a lot, and it's in my class. I teach a class on commercial determinants of health. And my students, we talk a lot about corporate social responsibility. And this is a great question. Thank you for raising this. It is a huge dilemma, right? Because, and this is especially the case, not only in the US, where a lot of local governments don't have enough resources to invest in parks, in gyms, in sidewalks, in local businesses, and supporting small businesses. But especially in developing countries and emerging markets, where communities have literally very, very few options. And so we've seen, Nestle, for example, going into Brazil and empowering women with vending carts, selling Nestle products. We've seen Coca-Cola in India empowering women by giving them small Coca-Cola kiosk stations, where they sell shots of Coca-Cola and people can get their cell phone charged. We all see these, and then we see in Mexico, investing in sports activities. We know that this is important. So public health professionals, of course, we need to realize this, but we also need to realize what's going on behind the scenes, right? And a lot of public health researchers have been calling attention to this as a strategy to increase the company's legitimacy and social support, where these industries are seen as something good for their community. And so what needs to be done is to educate our public about what is happening with this, right? Now, you have the question, do we say no? It's a very challenging, right? To say no, it's very difficult when there are no other options, right? We do want safe parks. We do want places where our kids can go and play, and we want to give opportunity. I think what we could ask for is industry pledges to, at the same time, raise awareness about their products and limit the advertising of their products or be more responsible with their products. And so I think, but I also believe that we need to replace these corporate activities with government investment in these areas, right? And I don't think that this is something that should continue. I think ideally we need government to step in and do these things that industries are doing. So but it's a lot easier said than done, right? I mean, it's very, very difficult to pour millions into communities. But it does pose an ethical dilemma. It's very difficult because they are having a good impact in many ways, right? We can't argue that empowering women, we want to see that, right? But we shouldn't allow corporations do this. We need to have government to do this. And maybe as public health researchers, we can highlight this, right? We can highlight that we cannot have government rely on corporations to do this. One other issue that this happens is corporate social responsibility. One of the things that happens is that when this happens, in a lot of countries, industries sell themselves as solutions to the problem, and governments see them as partners. And that really is really problematic because it gives a excuse for government not to do something when they should. And so that is, something that we really need to pay more attention to as well. But I think this is a very important topic that you raised, and something that that we need to think more about and realize. But I often talk to my students. When I mentioned this thing, we mentioned McDonald's sponsoring of a basketball tournament, right? And I always bring this topic up in my class, and a lot of my students don't really realize what the message is, what's happening here with McDonald's sponsoring this, or Coca-Cola sponsoring the Olympics, or when you see Coca-Cola's symbols in the background in the Olympics. We don't really question that, right? And so we, as public health researchers, we need to draw more attention to this. And my students are always surprised when I talk about this. And many have said that they didn't realize it until we talked about it. So, yeah, thank you for that question.
Yeah, that is such an important point that you made. It is, we do become sort of used to corporations. All of the buildings of all the sports teams are named after corporate. They're corporate driven, and that's just become part of our society. And a lot of the schools, you have high schools and public schools, you have these corporations that will take over sort of the food programs. And we just say, well, these are the challenges that we have as being under-resourced in certain communities. And I so appreciate, you really kind of highlighting the need to advocate on behalf of the government should be responsible for ensuring the health and well-being as opposed to leaning on these corporate interests. And I'm just curious, and then we're going to open it up for questions. I think Dr. Wilson and I have taken over quite a few questions. What would you say? You've kind of addressed some strategies that citizens and students and public health practitioners might kind of what steps we might take to advocate on behalf of moving the needle in the opposite direction of sort of these corporate drivers. But do you have any ideas of what a couple of priority areas might be?
Of what we can do? Yes. I think in terms of that's a very difficult question. There's a lot of things that we can do. But I think one area is increasing awareness about quality food versus access, right? And this is important because globally we're talking about food security. We're really concerned with climate change and lack of food security in the future, but we really don't discuss quality food and educating the public about what they're eating, the ingredients. And I think that that's so important, but also how they're linked to certain diseases. I think that's very important. So I think more campaigning and awareness on social media as well. Just last night in my class, we were talking about social media advertisements, and we don't see enough public activism on TikTok or on Instagram, educating our youth about the quality of the food that they eat, what are the ingredients in it that they're eating. So I think that that's major, and that's something that's very important. And that goes into my second, which is public advertising compared to corporate advertising. We need, as a community, as scholars and activists, to have our own advertising on social media and in public about raising the awareness of more government investment in providing access to foods, more government commitment to this, seeing this as a human right. This is something that I'm working on right now with the RWJ Foundation. In Brazil, Mexico, and South Africa, their governments have constitutionalized, included in their constitution, access to food as a human right. And we need, as a civil society, to raise awareness about this. Why are we not pressuring our government to make access to quality food a human right within our constitution? We go around the world, saying all these things about human rights, political rights, all these different things. But when it comes to food quality, we have said nothing about it in our country, right? Especially within our laws. But Brazil, Mexico, and South Africa have done this for many years. So I think that that's one area where we need to do more in public awareness, going to our local political leaders, going to our Congress, writing activism on this, creating this need for more political rights to nutritious foods. And this is going to be very important as nutritious foods become less and less accessible in the future. So that's what I would suggest. Yeah.
That was great. I love the quote, access to quality food as a human right, not just access to food. And I think that distinction is so important, especially in the era of ultra processed food. We do have one question that's in our chat, and we invite more of our webinar participants to add questions to the chat. This is a multi-section question from Fabiola. And the question is that the U.S. agriculture industry is the backbone of our food system, but what is its role in kind of this food industry as a commercial determinant? And then where is the political influence of the agricultural industry kind of stored or in this kind of intersection? I think this is an important question. I think we tend to separate out the agricultural industry and our food industries in some ways.
This is a very good question. I haven't done a lot of research on this in the U.S. on agricultural industry, but certainly, corn producers, all these major agricultural producers are very important, and investing in this agriculture is very important. But we really haven't known it's important to look at the linkages between these industries and corporations. We want, of course, supporting farmers and producing food is very important, obviously, for our own livelihood in our own markets. But we need to look at how this is, supporting the work of industries and the relationship between them. I think that's very important. I think that a lot of the congressional interest historically has gone into supporting farmers, and a lot of that has, any kind of regulations or any kind of, efforts to regulate the food industry could be harming farmers in many ways, right? By increasing costs on food industry. And so this is a very complex situation, because the more you regulate, the more you tax, the more you regulate these major food producers, that in turn harms farmers, right, in their livelihood. And so, but this is a very good question, and I think that what our government and our society needs to do is look at this and perhaps subsidize more of the agricultural sector to produce foods and support other companies that are focused on healthier food products. I think that could be one avenue to go down, rather than having the stronger linkages between agricultural food and these major corporations that don't really emphasize the quality of their foods. Maybe encouraging the creation of food companies that are more quality based, have better quality foods, and linking them with farmers. But that's a great question. So thank you for asking that.
We have another question, and it's also related to supporting our farmers, but in a very different way, related to affordable housing developers. And so we've seen a lot of this in California, where a lot of land that's traditionally used as farmland is being sold to housing developers, kind of under the guise of affordable housing.
Yeah, I don't know much about that. So farming land is being sold to housing developers as what?
As part of the affordable housing movement here, especially
Okay.
in California, we hear a lot about affordable housing and a lot of housing, large complexes going up.
That's interesting. I don't know much about that, but and so that's very interesting. And and that is that because of sort of the what is sort of driving that in California?
Our housing crisis definitely is driving it, right? There is an influx. There's a bunch of folks leaving California, but a bunch of folks here, who need homes, and the homes that are available may be, kind of, not affordable. And so that's what's really driving that. While at the same time, there is, these two competing issues, right? We need to find a house folks, but also we need, farms to produce local fruits and vegetables. So these two things are kind of butting up against one another.
Right.
And
that's
I don't
very
think
challenging.
think
Yes, no, that's very challenging. And of course, we want affordable housing. We certainly want that. But at the same time, going into the farmers having to sell their land is sort of impacting them. I mean, that's a very challenging issue. And this goes into the housing crisis, right? The affordability, really, and that is just like this, not the best option. And but I think that's certainly a public policy issue that really needs to be thought more. I mean, we certainly need to invest more in our farmers to provide these healthier foods, and so I think that's a very important topic. Yeah.
I think that kind of speaks to one of your other points about sort of the importance of, cross disciplines really looking at these issues, because, it's not the answer can't just come from, health professionals or from agriculture. It has to be multidisciplinary, how we look at all these intersections at the end of the day. We have a question from our global health faculty, Professor Sarah Sullivan. She's asking, do you think there's any chance that Mexico will start to tax the junk food products that we send to them? Is this taxation, is this the kind of taxation that's allowed under the free trade agreements?
Well, there is already a tax on ultra processed foods in Mexico. Um, and I think both the soda and the ultra processed food tax, I think, have been very successful in many ways. There's a lot of research showing that consumption of sodas have declined. Some would argue it's not high enough, of course, but I think that Mexico is short. Now Mexico and is very rare in that it's doing both of these, but I think that other countries are just starting only to do soda, sugary beverages, and have not gone into the food sector. Now, is it an infringement on NAFTA? I don't think so. You know, I mean, I haven't studied the trade policy that much. I mean, my understanding was it's really on tariffs and sort of and so facilitating the import of products. But I think that it really hasn't impacted the investment of these products in Mexico at all. But I think that it's been effective in sort of reducing consumption of these sugary beverages and foods. And I think it's been and it's really been a great example for other countries to pursue this. And so it's very interesting because Mexico and these other countries have done this at the national level, where other countries, including the US, only did this at the subnational, the state level. So one of the great things that Mexico showed was this can happen at the national level for all states. And so that's very important as well.
Thank you for that. And she has kind of a follow-up question that is asking about whether Mexico can put a tariff on the junk food.
Not that I'm aware of.
These are important questions
current,
that our students can delve into.
Well, I mean, I think the current Sheinbaum government that came from the AMLO Morena party is a very progressive party, and she has followed AMLO in the importance of addressing these foods. And I don't know. I mean, I haven't heard of this discussion, but I mean, who knows what could happen, but I think that she is very committed to implementing fiscal policies and other regulations that will deter and encourage people not to eat these kinds of foods. But yeah, it will be interesting to see what happens with the trade agreements, especially with the Trump administration. When I was in Mexico this past with the RWJ, I spent time with the trade in the people working on trade and food security, and there's a lot of concern about NAFTA, the future of NAFTA, and all these things. So it'll be interesting to see what happens. Things could change, and so we'll have to stay tuned.
We have a couple of other questions. They're primarily related to incentives for farmers to diversify their crops. And this really goes to kind of the link between agriculture and, big food industries that use a lot of corn and soy and the processing or ultra processed foods. And so do you know of any other countries where there are incentives for farmers to diversify and implement more environmentally friendly agricultural practices?
That's a great question. I really haven't studied this issue in my research. I don't think I could answer that, but I think that I've seen the opposite. I've seen in India, for example, I do talk in my book how the Modi government has encouraged soda producers and producers of sugary beverages or fruity beverages to work with farmers and to supply them with the fruits that they need for their beverages. But I haven't honestly seen much of a discussion in other countries that I've looked at with farmer diversification and investing and sort of delinking the corn and soy to the major commercial companies and going in other paths. It's something that I really haven't seen much on, heard much on. So I'm sorry, I really can't answer that question, but it's a very good question, and but I'll definitely look into that. I think that's a very good topic, very important.
Thank you. We have one last question. It's in the chat from Teresa Spezzano. She asked, and well, she states first that in her research among young adults, um, when taxes go towards a popular program like health education or some other program in the community, can it increase consumption? It could possibly increase consumption of this product. And have you looked at this in other countries?
Oh, yes. Well, this is a topic we talked about in our class last week or 2 weeks ago, where we talked about the Philadelphia soda tax.
Mm.
And well, we saw a documentary where Philadelphia, when they used that money from the soda tax, they invested in their schools and they provided vouchers for families for private school. And one of the parents that was interviewed for that documentary said that she was drinking more soda because she knew it was helping her daughter go to a private school. And we really talked about that reverse effect, right? Because when you link these revenue to educational benefits, that can have this reverse effect. And so we need to be careful. Now, what Mexico did was they invested their soda tax into water fountains. Remember what the Obama administration did. They invested their tobacco tax into obesity prevention awareness programs. So where the money goes, we have to be very careful with that, right? And so this could be a situation where what you're talking about where, and we've seen in Philadelphia, that it can have a reverse effect and have more, cause more consumption of these products. So this is a very, very important topic. You can't just do anything with these revenues. You have to be very strategic in where you're investing these revenues in.
Yeah, I mean, that example is just disturbing on multiple levels, that the funding is being used to support private schools and taking money out of the public education. So that's just bad all around. It's bad all around, in my opinion. But no, thank you for illustrating some of those other examples. And I know here in the Bay Area, we've had soda tax propositions be, voted out as well. And so it's an interesting challenge.
Yes, and now there's from what I understand, a block on any further soda taxes into 2030. So with California was very interesting in that it was an innovator, right? It was the first state to introduce a soda tax. And then there was a lot of corporate pressure and threats to withhold or include from what I understand, I may be wrong, but to include a vote on with the withholding of tax if further soda taxes are introduced. And the state voted to stop the introduction of any new soda taxes until 2030. And so it's a really interesting case study of where there's been a pause and where corporations have been very powerful in California. I don't know the details that well, but I did read that has happened, and so that's very concerning.
Yeah, I think one of our experts here in the audience says yes.
This is really a problem because we really need to talk a lot about this because it provides an example of where we can see policy reversal in other states. Where California was the example, now because of this reversal, other states may do the same thing, and this may happen in other states. So I really think that the next governor in the state legislature in California needs to revisit this issue and really need to reinstate these things because this is really a shame that happened.
Yeah.
Well, Dr. Gómez, we thank you and appreciate you being the second presenter in this year's social justice speaker series on the commercial determinants. I believe that you have provided a really great introduction to the food industry as a commercial determinant. We appreciate your contribution not only to our speaker series, but also your text that's coming out, Junk Food Policies, that's actually already available through the Johns Hopkins University Press. The link is in the chat, and also your chapters contributing to the overall text commercial determinants of health. So if any of our participants want more information, we encourage you to get those books and read up on it. Thank you so much. And we look forward to working with you in the future and collaborating and more opportunities to meet with you.
Yes, absolutely. Same here. And thank you so much for this wonderful invitation. It was really an honor to speak with you and your guests, and look forward to our continued work on these issues.
Thank you so much.
Thank you. Take
All right.
care. Bye-bye.
Good night, everyone.
Night.
Night.